four diseases were dysentery, typhoid, malaria, and smallpox. These diseases and others were killers during the Civil War. The worst disease by far was dysentery. This disease accounted for approximately 45,000 deaths in the Union Army, and also around 50,000 deaths in the Confederate Army. 2/3 of all deaths in the Civil War were from diseases. The second biggest disease was typhoid, also called camp fever. During the Civil War, it was 1/4 of disease deaths. This disease is very severe and causes a high fever, intense headaches, and intense rashes. Another big disease during the Civil War time was malaria. Malaria is caused by protozoal parasites and is spread only by mosquitoes. During the Civil War, there were 1.3 million cases and 10,000 deaths from malaria in the Union Army. Smallpox is another extremely dangerous and contagious disease caused by a specific virus. It causes a fever and bumps similar to chickenpox. But supposedly, in the 20th century, this disease was wiped out by global vaccinations. Some of the most medical advances throughout the Civil War life were saving amputations, the anesthesia inhaler, closing chest wounds, and facial reconstruction. The first antibiotic was penicillin. Alexander Fleming, the discoverer, was looking for ways to destroy bacteria. In 1928, he was growing lots of bacteria known as Staphylococci on agar plates. It was originally discovered to treat gangrene. Penicillin was also used to solve problems that plagued the battlefield. This was used during the wait time between when a soldier was wounded and when he was seen by a doctor for surgery or treatment. Penicillin's ability to cure people of many once fatal bacterial infections has saved so many lives that it is easy to understand why it was once called a miracle drug. These are just some of the antibiotics that were discovered after penicillin. Fleming found out the kind of bacteria that it would kill by leaving a plate of Staphylococcus bacteria uncovered. Fleming noticed that the mold that had fallen on the culture had killed many of the bacteria. He identified the mold as Penicillium notatum, similar to the kind found on bread. In the Civil War, they used the same pots and pans that they cooked in to also wash their clothes in. Many of their clothes were lice infested. During the Civil War, soldiers lacked basic hygiene. They had filthy living conditions, along with lack of knowledge about germs and bacteria, this causing thousands of soldiers to get sick and die. They also dug latrines too close to the drinking streams. The waste from the latrines seeped into the water supply, causing many to get sick. In 1847, Dr. Ignaz Semmelweis, a physician in a Vienna hospital, had discovered that the fatal infections were spread among patients by doctors who failed to wash their hands between examinations. Hand hygiene is important in reducing the bacteria and virus infection because many people have died from poor hand hygiene and germs making their way to the wound and then the patient dying. These are 5 different antibiotics. Antibiotics are types of medications that destroy and slow down the growth of bacteria. Antibiotics are used to treat infections caused by bacteria. Bacteria are microscopic organisms, some of which may cause illnesses. Antibiotics are important because if we didn't have them, there would be no way for us to get better when we are sick. Penicillins are used to cure skin infections ear infections, respiratory tract infections, dental infections, urinary tract infections, or gonorrhea. Penicillins can be combined with ingredients which will protect penicillin from the harmful bacteria enzymes that may destroy it before it forms its function. Good bacteria spend their days destroying harmful cousins, picking through leftovers and micromanaging calories, ferment sugars into lactic acid, and this helps lower the pH level in the intestines. Bifidobacteria, known as probiotics, which means that it's a microbe that helps to protect its host and prevent diseases. These benefits include diarrhea prevention in antibiotic treatment patients, cholesterol reduction, alleviation of lactose intolerance symptoms, immune stimulation, and cancer prevention. Humans cannot, on their own, digest many plant food molecules. In some cases, no, we can't live without some bacteria because it helps break down our food, and if not, we could possibly die from that. Antibiotic resistance can cause significant damage and suffering for children and adults who have common infections. Once easily treatable with antibiotics, microbes can develop resistance to specific medicines. A common misconception is that a person's body becomes resistant to specific drugs. However, it is microbes, not the people, that become resistant to the drugs. Antibiotic use promotes development of antibiotic-resistant bacteria. Every time a person takes antibiotics, sensitive bacteria are killed, but resistant germs may be left to grow and multiply. Repeated and improper uses of antibiotics are primary causes of the increases in drug-resistant bacteria. While antibiotics should be used to treat bacterial infections, they are not effective against viral infections like the common cold, most sore throats, and the flu. Widespread use of antibiotics promotes the spread of antibiotic resistance. Smart use of antibiotics is the key to controlling the spread of resistance. Some ways that bacteria can become antibiotic resistant is by washing hands, buying organic, don't take an antibiotic unless you absolutely have to, ask for the shortest course of antibiotics, and speak out. An essential part of preventing the spread of infection in the community or at home is proper hygiene. This includes hand washing and cleaning shared items and surfaces. Antibacterial containing products have not been proven to prevent the spread of infection better than products that do not contain antibacterial chemicals. Although a link between antibacterial chemicals used in personal cleaning products, antibacterial resistance has become a major clinical and public health problem within the lifetime of most people living today. While it is clear that antibiotics are pivotal in the selection of bacterial resistance, the spread of resistant genes and of resistant bacteria also contributes to the problem. We currently face multi-resistant infection diseases organisms that are difficult and sometimes impossible to treat successfully. Some common antibacterial products are soaps, deodorants, hand lotions, disinfectants, window cleaners, cleaning clothes, surface sprays, mouthwashes, toothpaste, garbage bags, plastic bags, textiles, and carpet underlays. In the past, Staphylococcus aureus and Neisseria gonorrhea infections were controlled by penicillin, but now almost always they're resistant to penicillin. These infections are dangerous because they can't be cured with antibiotics. it would be more of a problem in the future because the unnecessary uses of antibiotics may lead to more resting strands. Later, these strands will not be able to be controlled by antibiotics when it really is necessary. Preventive use of antibiotics on livestock and crops can also introduce antibiotics into the bodies of the humans that eat them. That's one way they spread so rapidly. Another way it can spread rapidly is from patient to patient. My third reason to prove that it strands rapidly is people not taking the antibiotic before they are fully done, which means it has not completely killed the disease. We are not always the cause of this problem, however, unnecessary use of antibiotics can turn into a problem. You can prevent antibiotic resistance by minimizing unnecessary prescribing of antibiotics, using the correct amount, and hand hygiene. Antibiotics could have a part to play in slowing down the speed of antibiotic resistance. Choosing the correct probiotic strand is vital, and not all have the same beneficial effects.